Good afternoon, everybody. So, today we are going to make ourselves a little video about when we should be calling the doctor, when should we be staying at home, and when to go to the emergency room. So, let's get into this. All right. So, these are the things that as a nurse, um, we are suggesting that you can stay at home and monitor. So if your child just has mild cold symptoms, runny nose, a little bit of a cough, but none of these are coming with difficulty breathing, you're not seeing them um, seesaw breathing, any of those things. They're still running around, they're still napping, everything seems to be going okay. They're eating and drinking, pooping and peeing, then just give it a few days and watch and see what they're doing. If we have a low grade fever under 100.2 for children greater than 3 months, then we are just going to be keeping them comfortable, medicating as necessary with Tylenol or ibuprofen, alternating if necessary. But really, we're just saving the medications for when your child is not comfortable enough to eat or drink and take their naps and stay comfortable. We want them to rest and hydrate. If your child has occasional vomiting, a little bit of diarrhea, but they are still peeing, their mouth still looks moist, it doesn't look dry and tacky and sandpapery, then just keep them resting, keep them hydrating. You can use fluids such as Gatorade, Pedialyte, popsicles. Fruit has a lot of water in it, so make it enticing for them. But Gatorade really is like your least favorite option out of all those. Coconut water is also really good. If your child has a mild rash with no fever, it's not super itchy, no problems with their throat or breathing difficulties, then give it a few days, see where it goes. If you're worried, take a picture of it each day so then you can show your pediatrician, is this getting better or is this getting worse? And if they're a little bit fussy, but you can calm them and make them feel better, they're fussy and then they're distracted and they can still nap, any of those things, then just keep an eye on it and see if something else starts to show itself. All right, when we should call the pediatrician today. So, if we have a small baby under 3 months, definitely under 2 months with a greater than 100.4 or 38 Celsius fever, then we are going to be calling the pediatrician, and most likely you can expect a trip to the emergency room, packing a bag, and you're probably going to be staying overnight for a few days because your baby is going to be guilty until proven innocent with a fever. They really take fevers seriously because you don't want, if whatever that infection is or potential infection, you do not want it to spread into the blood and then into the spinal fluid and the brain. That's your that's just not good. If your child has a fever that lasts more than 3 days. So up to about 3 days you're kind of suspecting, yeah, this probably could be a virus, but after 3 days and the fever's not going away or you have a fever with other symptoms, then we're really thinking that this probably could be a bacterial infection. And now it's time to call the pediatrician, either get into the office or the ER for some testing. Maybe it's strep, maybe it's something else, urinary tract infection. It's time to start investigating. This one's classic ear pain, pulling on the ears. If you see drainage from the ears, especially all of these things, if your child is also has a high fever, then we probably have an ear infection and you need to get checked out and get on antibiotics. So you're calling the pediatrician, getting a visit in the office. This is not really a reason to go to the emergency room for. Try ibuprofen or Motrin. That is your anti-inflammatory. That is going to work better than an Tylenol. Tylenol usually does not touch an ear pain for most children, in my experience. So, if your child is showing some signs of dehydration, so they're not, when they're crying, there's no tears, they've got a dry mouth, you've noticed a decrease in their wet diapers, their mouth just looks yucky, like sticky and just not moist. So, we need to figure out why they're dehydrated, and hopefully you've tried all the other steps before to keep this from happening. If you notice that your child has a barky cough, a little bit of noisy breathing, um, most likely if it's mild, they're still running around, they don't have any issues, then you can just kind of sit and wait on this one. If you have that child that has had croup 6 times and it's always a 2 in the morning visit to the emergency department, it's a rush there or it's an ambulance ride there, then you know that at the first signs of this that you are calling the pediatrician to get your prescription for your oral steroids, usually Decadron, and that is hopefully going to curb things before that 2 a.m. Rush to the emergency room. Most of the time, it doesn't go this far, but so some people know, and this happens a lot. But cold air is one of the best things that can help with that croupy seal bark cough. If your child has a worsening rash or has a fever with their rash, so you've been watching this rash for 2 days, all of a sudden they now have a fever to go along with this rash. You need to call the pediatrician because we have a change in symptoms. That's really the biggest thing of why we're escalating, is because we now have a change in the symptoms that your child has. So your child's symptoms are telling you new things. And when you have new things presented, now we have more to go on for what possibly could be wrong. All right. Why are we going to the ER right away? So, trouble breathing. One of the greatest things you can do as a parent, if you've never seen babies or children with difficulty breathing, is you can go on YouTube and look up videos for children with trouble breathing. So, breathing too fast, you'll see their ribs are pulling in. So when they breathe in, you'll see the actual outline of their ribs. They may be making like a grunting noise. You may also see, especially infants, they may do a seesaw breathing. So you're going to see their stomach and their chest going back and forth in a seesaw motion. That's a sign of distress. You'll also see, especially in babies and young children, you'll see them nasal flaring. So their nose will actually come out every time they're trying to take a breath in. And that's because they're not getting enough air in and they're trying to do what they can to make those nostrils bigger. Um, babies, for sure, babies are considered obligate nose breathers. So, what that means is that babies really only know how to breathe through their nose. So, if they're super stuffy, then they are going to have difficulties breathing and feeding. So, this is where your saline drops, your bulb syringe, your nose Frida, any of those devices to help clear that airway, clear that nose. Just being careful, don't use the bulb syringe, don't stick something into their nose too much because now you're going to cause swelling in there. So now you have swelling and boogers, and now you've got the double combo, which is not good. If your child has blue lips or blue fingertips with this trouble breathing, they're starting to get real drowsy with this trouble breathing. Unless you're right around the corner from the emergency room, I'd probably be calling 911 because your EMTs and paramedics have breathing treatments on board. They've got oxygen. They can treat your child on the way to the emergency room and start treatment right away instead of you getting stuck in traffic. Your kid's in the back seat and you don't know what's going on. If your child has seizures or is unresponsive, seizures are super, super scary. They're even scary for staff watching in the emergency room or in the hospital. You want to give them a good 30 seconds, which seems like forever. So we're giving them a little bit of time to recover out of that seizure. Most of the time, a ton of the times in kids, we get febrile seizures or fever seizures. It's not how high the fever went, it's how fast the fever spiked. So if they had 0 fever and now all of a sudden they have 103 fever, sometimes that can kind of short out the brain a little bit. They have a little bit of a seizure, they may be a little sleepy afterwards, but the seizure should stop itself within about 30 seconds. If they're not coming out of the seizure, if they are turning blue, you're not there, you can't see them breathing, any of those things that's going on, you're like, I don't know what to do. We're calling 911. The operator on 911 is going to talk you through what to do while the ambulance is on the way. So that's the most important thing. Don't hang up on them. Follow their instructions. That's what they're trained for. And help is going to get there and get your child the assistance that they need. If they show up and your child is fine, they're no longer seizing, they're sitting up laughing and cooing, then they'll check your child out and they may suggest like, hey, do you want to come with us in the ambulance or do you want to go in your own car? And they'll let you know if either option is fine. And if you don't want to go with them, you'll sign a little waiver and off they go. Another one important is persistent vomiting. So if your child has just projectile vomiting, it's like, not just dribbling onto their chest. It's not just coming out a little bit. It is clearing and coming like hitting you from across the room. So that's a sign of like a structure issue on the inside. If you notice that the baby has bright green vomit, especially in about a 6-week-old baby, that is also another reason you can call the pediatrician and just be like, hey, we're going to the emergency room. We're throwing up green vomit here. If back to kind of watch and see, if your child just has a little bit of vomiting, a trick is we want to give them, not a trick, but we want to give your child their stomach time to rest. So give them nothing to drink for about an hour if you can, and then you want to take a medicine cup and you're going to do about 5 milliliters of some sort of hydration fluid or a little chunk of a popsicle or a few ice chips, whatever they'll take. And you want them to take that little tiny sip of a hydration fluid, and you want them to do that every like 10 to 15 minutes and just super, super slow. Get them to get little bits into their stomach so that it can get absorbed into their stomach without overwhelming it. Eventually, their stomach will relax and start to feel better. And then they can start taking more and more and more. But your child's going to throw up and instantly be like, I need liquid. I'm dying. And as the parent, you're like, "Oh, I gotta give them something to drink," but really they're just gonna throw it back up because the stomach's irritated. So that's just a little, trick for helping rehydration that we use in the emergency room. If your child has a stiff neck, or on a baby, the fontanelle up here on the top, that soft spot is bulging. It's like looks like a cone. Or if your baby just will not stop crying, any of those, like kind of in a combo, super irritable. The cry will be different. It'll be like this just eerie, high pitched cry. Those can be signs that something is going on in the brain and the spinal column. So an infection, an irritation, something, those are things that need to be checked out in the emergency room, and can get very serious. So you want to go in pretty soon. If your child has a rash, not just like, oh, a few mosquito bite kind of spots or something, but these are like purple red. They start out tiny, they start to get bigger, and they'll start developing in different spots of the body. Sometimes you'll only see them on the top half of the body, sometimes they'll only be on the bottom half of the body. These are not like a skin rash. This is a sign of broken capillary vessels inside the skin. So this is a sign that something is going on in the body that's all over the body. So this is important to get checked out. If you have any injury that has caused uncontrolled bleeding, so recommend every parent to take a Stop the Bleed class. You don't have to take a physical class if you can't. You can get a ton of the information on YouTube and just learning everything you can. The biggest thing you can do is applying direct pressure to that spot until you can get help or it stops bleeding on its own. If your child has a broken bone, do what you can to stabilize it. Newspapers, anything like a book or something that you can kind of hold that limb stable with. Or if you don't have anything, you're like, I've never done any of this stuff before, you can just call the ambulance. They will come, they will splint your child, they will give them pain medicine, and they'll get you to the hospital. But definitely a broken bone needs to go to the emergency room. Um, one thing, if your child has like severe belly pain, has a for sure broken bone, has a big cut, a laceration, and you're like, huh, we might need some sleepy medicine for fixing these things or the surgery or something like that. Do not give your child anything to eat or drink until the doctors in the emergency room give you permission. They may need your child to have an empty stomach for a certain amount of hours, a few hours, before they will do those sleepy medicines so that your child can get fixed. And you don't want them to be like, oh, we just ate McDonald's 5 minutes ago on the way here after he broke his arm because now he has a full stomach and they won't be able to do the procedure for hours. Last but not least, severe allergic reaction. So, if your child has known allergies, you should have an EpiPen with you, multiple EpiPens everywhere you can, because those are super important to give as fast as possible. But you may notice hives on the body, they may have trouble breathing, they may have swelling in the lips, in the throat. If your child has scratchy, itchy throat and is having trouble breathing and they have a known allergy to something, that is your opportunity to give that EpiPen because you don't want their throat to close up. Another symptom of a severe allergic reaction that a lot of people don't think about is severe vomiting. So, say you have an allergy to peanuts and you ate something with peanuts in it, your body is going to recognize that foreign object that you're allergic to, and your body's going to try everything it can to get that out. So, it's going to force the body to vomit to remove that allergen from your body. So, if you have a known severe enough allergy, give the EpiPen and we're calling the ambulance because they have more drugs on board that they can give to your child. Um, but overall, we in the emergency room, we trust you. If your gut said come to the emergency room, you don't know what's wrong with your kid, we believe you. If your child had a fever, you don't have to keep them unmedicated. We believe you that your kid had a fever. If your child walks through the magic emergency room doors and all of a sudden feels better, we still believe you that your child has been a limp noodle all day and now all of a sudden they're great because it's an adrenaline rush for the children when they come out to the emergency room. So a lot of times they ride that adrenaline for a little bit. But trust your gut, go with it, and hopefully this helped. And look forward to doing some more training and talking in the next video. Thanks.